Hi, good evening everyone. Vanakkam. Thank you so much for joining. So we have again Jay Surya with us. Probably he's going to take on managing the joint pains. Jay Surya, very good evening. Thank you so much for joining.
Thank you, sir.
Yeah, probably you may go on starting the session now.
Happy evening, folks. This is Jay Surya. And today I'd like to talk about something like osteoarthritis. Okay, first of all, osteoarthritis, it is a long-term chronic disease characterized by the deterioration of cartilage in joints, which results in bone rubbing together and creating stiffness and pain and impaired movement. Let's make it simple. Seems to be a quite weird definition, right? It is nothing but a disease characterized by degeneration of the cartilage and its underlying bone within a joint, as well as the bony outgrowth. The breakdown of these tissues eventually leads to pain and joint stiffness. The joint most commonly affected are the knees, hips, those in the hands and spine. And to be in simple colloquial Tamil terms, ரெண்டு எலும்புக்கு நடுவுல இருக்க ஜவ்வோட தேய்மானம் due to friction ஒராய்க்கிறதுனால when two bones move in the opposite side or along the same side, which causes friction, this deformity this leads to a condition called osteoarthritis. Now the nerves vessels between the two bones could also get damaged. There's a constant pain because of constant friction between the bones due to the erosion of the cartilage. So it is the most common form of arthritis, that is the osteoarthritis, which is characterized by the articular cartilage, the so-called java, which leads to fibrillation, fissures, gross ulcerations, formation of ulcer. First of all, what is ulcer? Ulcer is nothing but in Tamil term teimano, which takes place along the margins of the bone, and on the other hand, fissure, which fissure is nothing but the furrows caused between the cartilages due to the damage. Due to the friction caused, due to the friction, everything happened in the cartilage. Large joints are most commonly affected, like hip, knee, and foot. On the other hand, the metacarpophalangeal, distal interphalangeal, proximal interphalangeal, and even the carpometacarpal joints, the joints, the joints between the radius and the ulna, the bones in the forearm. What are the uncommonly affected joints that are dealt with osteoarthritis? Maybe patients will mostly complain about the large joints. To a smaller extent, they may complain about the smaller joints also. So osteoarthritis mostly affects the hip, knee, foot, cervical spine, and lumbar spine. Over years, it can progress to smaller joints too. Uncommonly, it affects the shoulder, elbow, temporomandibular joint. In a normal person, what are the mechanisms which protect the joints? Normally, we have a lot of movements for many joints. The movements are extremely very vast. And in case of shoulder joint, it has a very great range of movement. So what's the mechanism that protects the bone and the cartilages? The destruction are when it's getting eroded or getting ulcerated, which is being protected by the joint capsule. There are a lot of supporting ligaments and a lot of tissue which helps, and obviously the muscle bulk which takes up the load when the load falls on the bone joints. The sensory afferents, normally when there is some sort of friction and pain, we tend to move our joints from the position. For example, when we are in a squatting position for a long time, there seems to be pain, and we tend to stand up unless we are given punishments like kneel down, where we didn't complete the homework or something like that. But these sensory afferents have a different type of degree of impulse for each and every person. a person can kneel down for half an hour, and some can persist in the same position for a longer time too. It depends upon the practice and the capacity of the joint. So it is also dependent upon the bone which is underlying. Suppose I have a bigger and a stronger bone which is denser, I'll be able to manage more pressure. I mean the more workload that is given on the joint. What if the bones were brittle? So what will happen? There will be lesser deposition. I mean the lesser deposition of the calcium, and in turn the lesser deposition of the phosphate. Then what happens? The bone marrows. I mean the bone marrow matrix become less denser. Hence the formation of a weaker bone. So the joints will become more devoid. That's why most of the people have an undergoing osteoporotic activity. Sorry, there seems to be some messing up with the slides. Yeah. Where did I live? Something like dividing of bone, right? That's why most people have an undergoing osteoporotic activity, and have a greater chance of osteoarthritis. And let's move something like microscopically. Chemotactic mechanisms that occur. It is nothing but the disease of the cartilage as it affects the cartilage between the two bones of the joint. There's something called as IL-1. It's nothing but the interleukin 1, which is a pro-inflammatory component that increase the inflammation in the area of its production, and it's capable of inducing chondrocytis and synovial cytis. Now, what is MMP? Matrix metalloproteases. These are responsible for degradation of the articular cartilages. As IL-1 is secreted, and it increases the production of collagen 2 and proteoglycans, anything which can lead to inflammation and prevent repair. Now, IL-1 is a very important thing. I'll tell you about this later, why it is important. Let's look at the normal joints and the articular joints. How will it look? The normal joints have synovial fluid. You could see the slide. The normal joints have synovial fluid which lubricates the joint, and in the joint, the joint has a cartilage between the two bones. Now, in case of a osteoarthritic joint, the cartilage starts breaking, which leads to cracking of the surface. I hope you could see the cracking in the surface. There's a vast difference between the present slide and the previous slide. There's a cracking between the surface, which in turn causes the gaps in the cartilage, and it can expand up to the bone. And the final stages, we could sense the synovial fluid. It gets leaked into the cracks that are formed in the bone surfaces. Completely, the cartilage is replaced, which causes further damage and deformities in the bone, as we saw earlier. So, what are the other factors that we need to know? Age. Obviously, increasing age will cause osteoarthritis. Sex, on the other hand. I'll be dealing with each and every factor soon. What about bone density? As I told you before, lesser bone density, greater the load on the joint. Then comes the replacement therapy. People generally replacement therapy. People, perhaps generally women in the post-menopausal stage, that is where there is depletion of estrogen levels, dysfunctional, and in case of something called as DUB, dysfunctional uterine bleeding, and AUB, abnormal uterine bleeding. These people are normally treated by hormone replacement or estrogen replacement therapy. These people have a high susceptibility. Now moving on to other systemic factors. All of these will finally lead to osteoarthritis. The, the local biochemical factors, muscle weakness, repeated injury can also lead to osteoarthritis. So first we will deal with age. Yeah, osteoarthritis is a osteoarthritis is a rare in young people, but it increases by about 50% over the age of 70. In general, females are more susceptible. Only a very few handful of females are not susceptible to these diseases and disorders. Some diseases like SLE, that is simplex lupus erythematosus, and osteoporosis. Uh, there are there's a lot of genetic associations which are related to with the HLA series of genes like VL44 and VL12 are which are highly related to osteoarthritis. On the other hand, joint deformities like bow legs and people who have rickets, the to be more precise, the vitamin D deficiency and people with not knees are highly prone to become osteoarthritis. And the obesity plays a key role in promoting osteoarthritis. The one word that you people have to remember is pro-inflammatory conditions. I would like to repeat, pro-inflammatory conditions, which also cause hypertension, atherosclerosis, diabetic mellitus, and obviously, what did we see? What is IL-1? It is a pro-inflammatory factor, right? Oh, which has high activity in case of obesity. So hence it leads to osteoarthritis. And most people like yeah now there are something something called as joint overuses injury. Yeah. Now what is this joint overuses injury? uh, you people would have seen these porters, I mean the occupational hazardous, right? uh, they are not well trained enough. It's just because of their job they are lifting a heavy load, and they are not well trained, and they are not fit for lifting such a huge load. uh, and on the other hand, the runners and the training athletes who do not warm up properly, perhaps to be more precise, the younger and the old athletes who have insufficient training, that too in India, it's a very huge number. uh, a lot of injuries and repeated injuries that are necessary to cause IA is very prone in India. So let's ask this handful of lot, your grannies and grandpas in the home. Uh, Most of them will be prone to osteoarthritis. Actually, the hemostatic pressure rises between the bones that cause that leads to osteoarthritic activity. Uh, in that case, all the load that fall leads to synovial compression, and in turn, what will happen? It will obviously that due to the compression, there will be a leak in the synovial fluid. As I was shown in the previous slide, it's something like a capsule where something like a coconut. I mean. Half opened coconut where there is it is a fluid filled cavity. Synovial fluid is something like the uh, fluid inside the coconut. So what will happen if the coconut breaks? The fluid will obviously flow out, right? The same thing happens in case of this synovial compression. I mean the synovial tissue compression, which will cause the effusion of the synovial fluid, perhaps the synovial fluid leak, and in turn synovial inflammation will take place. Now the osteophytic breakdown of the bone and damage will cause the joints to I mean the cartilage will wither out. Periodically the cartilage will wither out, and the bones will be very prominent, and they'll start brushing like something like brushing your teeth, right? I mean they'll start rubbing up, and which in turn leads to uh, bone deform. I mean, it is a very painful situation. And let's move on to something let's move on to the part of the differential diagnosis. First of all, we'll find out how to diagnose it, then we'll move on to differential diagnosis. uh, Blood test, obviously with blood test, we can't find the we can't rule out whether there is osteoarthritis or not. uh, Perhaps with synovial fluid test we can just rule out the the possible risk factors like rheumatoid arthritis and gout. To be precise, gouty arthritis and polymyalgia and so on. On the other hand, the subchondral sclerosis and lesion on the bone. Okay, the lesion on the bone, the lesion of the bone due to subchondral sclerosis too. On the other hand, let's talk something about walking up the step and down the steps. Now, uh, what la? One sec. We'll talk about the radiological aspect. Generally through X-rays and MRI, that is magnetic resonance imaging, and through CT scans, these arthritis and the osteoporosis could be more prominent and can be diagnosed very easily. Uh, in the radiological figure, you could uh, see the formation of the we are seeing about the knee joint where uh, the femur is on the top and the tibia is on the bottom. It is called as femorotibial joint. In this joint, there is a narrowing of space between both the bones, where there is formation of the cysts and there is subchondral sclerosis, as I said earlier, and uh, perhaps there are osteophytes too, the formation of osteophytes too. No, what's osteophytes? Osteophytes are nothing but the breakdown of the bones which get settled between the joint cavity, which leads to further more inflammation. And yeah, in the first figure, the one on the left top corner of the slide, you could sense, excuse me, you could sense a normal knee, and there is a bone spur in the left side picture, the right side picture of the top left corner of the slide, where you could find a bone spur, right? Generally the medial side of the bone, that is the knee joint, the medial aspect, that is the inner aspect, the medial aspect gets more damaged than the lateral aspect, the outer side of the bone. Why is it so? It is due to the bulky muscular structures which cause more friction if there is damage or formation of the bone spurs. On the other hand, uh, let's talk about some facts. Like in every 250 children globally, they suffer. Globally, around 250 children suffer from osteoarthritis and rheumatoid conditions like that every year. Well, there is no definitive cure for osteoarthritis. It can be managed with treatment and lifestyle changes. And it is the second most common rheumatologic problem, and it is the most frequent joint disease with a prevalence of around perhaps I think 22% to 39% in India. And osteoarthritis scores top 5 chronic diseases in adult population. It is about 4 to 6 of us. In the adult population, there are in a number of 10, the most probably 4 to 6% are osteoarthritic. Now we'll come to something like climbing up and down of the stairs. Now, in case of climbing up and down, I mean climbing down and climbing up, which will cause more pain? What do the elders feel a lot? I mean, feel regarding climbing up and down? Let me be clear. As I said earlier, the medial part of the knee joint gets more affected, right? So, hence, while climbing down the stairs, they are more. I mean, they feel more pain. And on the management part, weight reduction is the first thing, and the patient must be educated regarding the management first of all, and control. In case of controlling of the pain, I'll be coming up with the pharmaceutical and non-pharmaceutical aspects soon. And in case of management, weight reduction, the we people are more exposed to something called as mobile phone lights, where we don't that too in this quarantine, most of us are prone to sit in a room and around, I mean, gadgets laying around us. So what we'll have to do is something like we'll have to move out and do some workout so that we don't create more diseases. I mean, in case of as I said, the phone light, we must gain something like for the rise in vitamin D. We must go around go under the sunlight. That too, the peak time for the absorption of vitamin D from the sunlight is around 9 to 12 a.m. in the morning. And let's move on to the treatment part, the pharmacotherapy and the non-pharmacotherapy. In case of pharmacotherapy, uh, actually, what people, when someone, I mean, due to knee pain, what generally people do, they really tend, they actually tend to get painkillers like, I mean, uh, to be more precise, ibuprofen. Ibuprofen is nothing but the common name is paracetamol, and they even tend to go with a non-steroidal anti-inflammatory drugs, right? Yeah, this is the pharmacotherapy thing, uh, where the ibuprofen, and on the other hand, they go for naproxen and so on other medications, but which in turn will cause kidney diseases in the later part. On the other hand, the non-pharmacotherapeutic thing is doing exercise and correction of the malalignment. Malalignment in the sense the knot knee, uh, and the genu valgum and the varus, and so on. On the other hand, the people must not stress on these stress more on these joint pains, as there is no proper medication for osteoarthritis, as it is a progressive disorder, and as the disease progresses, in the final stages of osteoarthritis, uh, there is something called as total knee replacement or total hip replacement, which I mentioned earlier. Uh, the these replacement therapies will persist for something like 10 to 15 years. So now the take home messages, that we'll have to prevent before getting affected, right? So let's increase our let's have a healthy diet, like let's avoid these junk food, I mean junk foods, and we must avoid the red meat. To be more precise, the red meat must be avoided, and boiled foods can be taken. Thank you. Any more doubts? Now the doubt session, please. Yes sir, yes sir. Happy evening, Mr. Arvind Shudar. You have asked me something like, what is SLE? SLE is actually, it is expanded as systemic lupus erythematosus. It is a it is to be I'll be very clear about SLE. Uh, Hope you know about the white blood cells. Our body contain cells. I mean cells, tissues, organs, and so on, right? On the other hand, there are something like oxygen carrying cells, that is the RBC, and the fighting cells. To be more precise, the fighting cells are called as WBC, white blood cells. These white blood cells, due to some genetic disorder, they tend to consider our own body as a foreign body, and they start fighting with the body. That's it. And there is no medication so far for SLE. And on the other hand, Miss Gopika Karnan asked something about what are the foods that has to be avoided. Uh, as I said earlier, red meat has to be avoided, and the foods, something like the fried foods. Let's uh, let's make it more precise. Something there's something called as AGE, advanced glycation products. I mean, the fried, grilled, roasted proteins and fat-rich foods, right? That increases the probability for osteoarthritis. We must reduce them, and you can have something like acidic solution. To be more precise, lemon juice and vinegar. On the other hand, the foods with low temperature cooking with moisture, something like steam cooked foods or stewing foods can be taken. Yeah, thank you, Ms. Gopika. And on the other hand, Mr. Arvind Chudar has asked how to manage SLE. As I said, it is a genetic disorder. It's not caused by something like uh, it's not uh, caused due to the radiations after the birth or through other morbidities and comorbidities of other diseases. It's actually from a genetic disease which is a X-linked recessive disease. It can get transmitted from the mother to the child. So I think there is no management, and uh, people are trying. I mean, it is in the best hands for the uh, for the preparation of medications. And yeah, thank you, Mr. Arvind Chudar. And Miss Ghospira, right? Yeah, Ghospira. She has asked something regarding the explain about gout problem. Okay. What is gout? I mean, gouty arthritis. We are talking about arthritis, right? What is gouty arthritis? Gouty arthritis is nothing but there is deposition of the calcium in the joints. Perhaps to be more precise, the distal interphalangeal joints and the uh, to be in simple terms, the joints in the fingers. There is deposition of calcium which causes something called as gout, which in turn causes inflammation. Thank you, Ms. Ghoshvira. And on the other hand, Gopika Kannan has asked something. Any real life patients you have seen so far? Yeah, perhaps my mom is an osteoarthritic, and I have seen a lady around the street who, has, who is not able to walk at all. She's using wheelchair, I guess. Actually, most of us are prone to osteoarthritic, Ms. Gopika. Only a very few, or I mean, something like they are standing inside the circle of uh, not being osteoarthritic. Thank you.
Just say you have one more question.
Yeah. Good evening, Mr. Joel Stewart. You asked something like how to confirm osteoarthritic. I said you through the synovial fluid test, where there are no blood tests. Through blood tests, we can't detect osteoarthritis, and the radiological aspects will provide a clear evidence for osteoarthritis. Where this synovial fluid has something like hyaluronic acid, uh, which I mean the hyaluronic acid test will make us to differentiate between to that will help us ruling out the other differential diagnosis like the rheumatoid arthritis and the gouty arthritis. As I said, the MRI, CTs, and the X-rays will make us confirm we have got osteoarthritis. In the starting stage, with the help of the pain and stiffness after waking up. If a person complains of stiffness after waking up and he couldn't move a muscle, perhaps to be more precise, he couldn't get up and walk to the washroom, then that could be a sign or symptom of osteoarthritis. Thank you, Mr. Joel Stewart. Mr. Arvind should have asked something like any symptoms to identify the starting stage of SLE. Yeah. Uh, Actually, Mr. Arvind should I just found one of my colleagues' sister being systemic lupus. I mean, she has got a disease of SLE, where she's actually a fourth standard kid. She has being a fourth standard kid, she has attained puberty. There will be very prominent signs like the paleness of the skin, and they'll be very weak, and they'll be very premature due to the steroids given. Yeah, thank you. On the other hand, Ms. Gopika asked about the food that should be avoided, right? Uh, as I said, the fried food and the foods with omega-6 fatty acids like egg yolk and the red meat must be avoided, and the maida, which most of us uh, crave for, that must be avoided. And the fried foods, even the salts and the preservative drinks like the carbonated ones must be avoided, and eh, even the dairy products, some proteins, even in case of dairy products, some proteins present in the dairy products can trigger the inflammation too. Thank you. Mr. Arvind, yeah, you asked something like how to avoid to pass to the following generation from SLE. Okay, as I said you earlier, that is, it's something like something which is flowing inside the body, which causes to the. I mean, if water is flowing through a body and the water causes damage to the pipe. I mean the if water is flowing through a pipe and if the water causes damage to the pipe, then in that cause, the water will be flowing all. I mean through the whole pipe. Something like WBC is flowing around the whole body, right? So there is no medication that is found that could pass on to the. I mean that could prevent the passing on the SLE to the younger ones. Only steroids are given, I think so. Steroids are the only best resolution that we have got as far as now is concerned.
Any more questions, people?
Yeah, thank you, Mr. Arvichpiller.
Thank you போட்டதுக்கப்புறம் திருப்பி உட்காந்து டைப் பண்ணக்கூடாது. சரியா? பண்ணுறதுன்னா பண்ணுங்க, நான் வந்து புரியல. ஆனால் ஜென்ரலாக சொல்கிறேன், நீங்கள் என்ன பேசி முடிச்சதெல்லாம் முடிச்சதுக்கப்புறம் திருப்பி நீங்கள் உட்காந்து டைப் பண்ணி சரி, இப்போ பண்ணுறதுன்னா பண்ணுங்க, நான் சொல்லிடுறேன் இனிமேல் பண்ணுறதுன்னு.
Folks, any more questions or doubts? Mr. Arvichpiller has asked, is SLE affect the female child or male child possibly? As I said you, it is a X-linked dominant, X-linked recessive disease. Sorry, X-linked recessive disease. X-linked in the sense it is something towards the maternal part, the mother's part, and it is not transmitted to the male child, and it is transmitted more to the towards the female children. Uh, males are uh, males are mostly carriers. Thank you.
Any more questions, people?
Thank you, Mr. Arvichpiller, and Mr. Akash Gopal has asked something about the mental problems regarding the lack of joints. Lack of joints. Mr. Akash, can you be more precise about the question? Mr. Akash Gopal, I think he seems to act sarcastically. I could get it, Mr. Akash Gopal. Thank you. Mr. Ariv Chudar, you have asked something like, is there any precautionary tests uh, to be taken to identify SLE, right? As I said you, actually, only by something like there is something called as cytokine storm. As we could see in something like cytokine storm, not exactly the cytokine storm, uh, as we see in the COVID-19, right? Which causes progressive degradation of the bones, where, as I said you right, I have met a child of class 4 who has got lupus erythematosus, where her mother has got both the legs knee replacement thrice in a lifetime. That is very something like very psychotic, right? I mean, she is given more psychotic drugs, and it is very very painful, right? So only by testing the serum sample, it could be identified. I mean the plasma sample. Sorry, not the serum. And thank you, Mr. Richard. And Lavanya has asked something like how to get rid of uh, rheumatoid arthritis. On the other hand, rheumatoid arthritis is a autoimmune disorder, right? Mm, there are certain medications which are given, but it is also under development. I mean, the medication is also under development. Thank you. Actually, these rheumatoid diseases, they don't have a permanent cure. As they are something like in case of rheumatoid arthritis can be. I mean, the arthritis starts from the younger age. In case of osteoarthritis, it is more prevalent in the elderly lot, right? So in case of rheumatoid arthritis, it could be seen even from the younger ones. Actually, the medications is not yet found. Thank you. And Darshini, good evening. I asked something like, what is the incidence of osteoarthritis in India? As I said earlier, it is nearly around in a people of 10. I mean, in a group of 10, 3 to 6 are prone to be osteoarthritic. That is a vast number, right? On the other hand, 26 to 36% of the total Indian population is prone to osteoarthritis every year. Thank you.
Any more questions, ladies and gentlemen? For those who have joined later for the session, probably you have joined only for the Q&A session. If you have missed the session, this particular session is live on YouTube and it will be there on YouTube also. Okay, you hope you could have got the YouTube link also for it. So you can just log into that particular link and you can just go on seeing the session from the start. So that might help you also at any point of time.
Mr. Akash Gopal, he asks, so what inspired you to take this topic? Uh, yeah, Mr. Akash, in this lockdown, most of us will, I mean, will just pull ourselves around the gadgets, and we don't do. Most of us don't do workout, and most of us tend to eat more red meat and the fried ones. As we are not able to we are not able to buy them in the local shops or something like that. So we have come to something called as more sedentary sort of lifestyle, which will lead to other diseases. I mean, obesity being the major cause of many diseases like hypertension, and by today's topic osteoarthritis, and which in turn like the obesity will lead to the CADs, coronary artery diseases, the to be precise, the atherosclerosis, the block in the tubes that supply the heart muscles, and on the other hand, it leads to much and much more. Obesity being the major problem for most of the diseases. Most of us are by now obese. Being in this lockdown for the past 4 months, most of us would have taken the home food and would have. Uh, Most of us are more prominent to more diseases unless we do the normal workout, the isovolumic workout, which I mentioned in my previous talk. Thank you.
Yes. I guess, okay, someone's coming with a question. Okay, thank you so much, Jai Surya. I guess people are done with the questions.
Uh, uh, Thank you, sir. Thank you very much. Good day.
Is there anyone typing a question? Is it a question? No, thank you. So thank you so much, Jai Surya. Probably that was a good session as well. Probably many of them would have been benefited by this because due to this lockdown, as you said, we are just whiling our time with the gadgets, right? So hope this might change and probably the food habits and the way of living the life should change to get rid of the osteoarthritis. Thank you so much, Jayshree, again.
Yes, sir. Thank you very much, sir. Good day, sir.
Good day. Thank you so much, people, for connecting with us. So I've shared you the feedback link. See, okay, there's one more question which has come out.
Yes, sir. I could sense Mr. Akash Gopal being more interested in this topic. What will happen if athletes get arthritis? What will happen? There will be degeneration of the cartilage, and in turn, the bone. There will be friction, a huge friction due to the synovial fluid. Uh, uh, Depletion of the synovial fluid as it gets leaked out due to the hydrostatic pressure in between the joints. The joint capsule, the concept of coconut, as I mentioned earlier. So what will happen? There will be a rupture of the surrounding vessels and the nerves, which will cause a huge pain, and in turn they will not be able to perform in the future athletic events. That's it. Thank you, Mr. Akash Gopal.
Right. Thank you so much, Jai Surya, and thank you so much, people, for probably spending your time with us.
Yes, Mr. Gopal, they will not be able to perform as it is a progressive disorder, right? Thank you.
Any more questions? Okay. So thank you so much, Jai Surya, and thank you so much, people. So
Thank you, sir. Good day,
uh,
sir.
good day. I've shared you the feedback link and also the GPage link, review link. You can just share your honest feedback there. The link will be active till 12 midnight, and also you can just go to the GPage anytime, and you can just review us so that it will keep us encouraged to get to more webinars. Thank you so much, people. Meet you tomorrow morning, 11 o'clock. Until then, bye. Good night.